I'll just give, for some of you have already participated in past datathons. If you are new, this might be new to you, so I'll just give you a quick intro on what our datathons usually look like. So our datathons are meant to be hands-on work with real data. So most of the time, if you are learning data science, you're just getting pre-cleaned, perfectly neat data sets. This is more of a real data. It is collected from a real organization that needs our help. We want to serve a good cause and make a real impact. So we are taking this work seriously. It's not just us trying to mess around with data, but we are trying to deliver a good value product, reports, analyses to our partners. Every contribution is valuable, so it doesn't matter if you're just starting out in data science and you have questions that you think are super beginnerish or not. Like, we appreciate all of them, and everybody learns from each other. And we believe that everyone can learn something from one another throughout this process. And our general attitude to things is we figure it out together. So it's never just on one person. We all kind of try and pitch in and figure out how to solve a problem in the best possible way. In terms of volunteering requirement, we understand everyone has busy schedules, so not everyone can dedicate a ton of hours to this. So everyone is welcome to volunteer as often or as much as they can and as they feel comfortable. And one other thing, we are not making this a competition. So we have 3 different teams that are going to explore different areas. It's not a competition. We want this to be collaborative. We want people to work with each other and learn with each other and grow as a result of this. And finally, we prioritize a supportive, respectful, and collaborative environment. So be nice to the others, be respectful, work well together, try and jump in and help others if you can, if you know the answer, guide people into the right direction if you know where to guide them. So really just be nice, have fun with it, and take it seriously, because we want to give ElderNet the best possible analysis we can. And with that said, I will pass it over to Brandon. ElderNet is our partner this year, so they are a wonderful organization that does a lot for the community. So I'll pass it over to Brandon to give us an introduction on ElderNet and tell us a little bit about what they do and how we can contribute.
All right, thank you, Carla, and thank you everyone for being willing to participate and go into this journey with us. First, let me just give a little bit about ElderNet. ElderNet was founded in 1976 as a result of community members noticing that their neighbors were being forced out of their homes because they were losing the ability to complete things that they had normally done without issue. So if you think about it, if you lose your ability to drive and you don't have family or friends, or you can't afford to take a cab or public transit, how are you going to get to your doctor's appointments? And if you can't get to your doctor's appointments, your doctor has every ability to say, you can't live on your own, you have to go into a nursing home, into a retirement community. So seeing all of these needs come up, ElderNet was created. And we provide a safety net for older and disabled adults to help them remain in their homes. And we also help people struggling with food and financial insecurity, helping them maintain their stability. So in 1976, our volunteer program was born. This provided round-trip rides to and from doctor's appointments, pharmacy, grocery store, bank. We have a friendly visitor, friendly caller program where community members would just reach out to people who were isolated and at home and just give them the social engagement that they need to remain connected with those around them. And we also had some volunteers who would go in and do minor odd jobs, such as changing a light bulb or a smoke detector battery, things that just may become a little bit too strenuous as you age in place. In 1985, our mission was expanded to offer all of these services to people of all ages living in the community who have a disability. And we also expanded to hire our first social worker to help connect people to public benefits that they may qualify for. In 2009, our mission expanded again. At the height of the economic recession, we opened our community resource center and food pantry. The Community Resource Center houses the community's only full choice food pantry, meaning that during non-pandemic times, if you come into our pantry, we give you a bag and let you take the food that you and your family need. rather than giving you a bag that's prepackaged. We have a care coordinator in the pantry that will help connect people to resources and things that will help them remain stably in their home. We have an Ask a Nurse program provided in partnership with Lower Merion with Bryn Mawr Hospital. That wasn't supposed to go back. Okay, we'll keep it here. With Bryn Mawr Hospital, and a very unique emergency financial assistance program that will provide one-time financial payments to help people deal with bills that come up in an emergency. So for example, if the winter months roll around and somebody can't afford their first delivery of oil to heat their home, we will pay that for them, or a portion of it for them, just so that they are able to remain home and heated during the winter. So our programs are broken down into the three programs. We have volunteer services, which does offer our escort driver program, our odd jobs and friendly visitor and friendly caller program. Now, our volunteer opportunities are very unique. In other organizations, they will ask you for a commitment up front to a certain number of hours, maybe days, that kind of thing. All of our volunteer opportunities are completely open to your schedule. For our volunteers, if they have a 2-hour gap in their schedule and they want to fill it by taking somebody to a doctor's appointment or taking someone to the grocery store, it's as easily as clicking a button and you can sign up and take somebody on those trips. We also have our volunteer services really transcend traditional volunteerism in that we create cross-generational relationships that otherwise wouldn't be formed in the community. And one of the examples I always like to use is it was a gentleman and his two daughters, his two younger daughters, were volunteering with this woman. She had come from Poland during the war, and they would go in and just spend time with her. And the one day she just happened to say to him, before I die, I would just love one more traditional Polish meal. And 2 weeks later, he called, said, get dressed, we're coming to see you. And they went over, and the entire family took her to a Polish restaurant in Port Richmond and bought her a traditional meal. So while they may start out as volunteer opportunities, a lot of what happens is these take root of their own, and people really become family with each other. And for people who are isolated or don't have family in the area, it's a very important and powerful thing for them to feel. We have a care management program. Again, this provides 2 care coordinators to the community and helps, they walk alongside our participants and their families as they navigate their changing lifestyles. They provide support during crises. They provide information and referrals for services, but they also offer guidance because a lot of the times whenever people get to us, they are in crisis because nobody really plans for every emergency that could come up. So we're there to provide a very stable and supportive environment for them to learn and grow and find the different resources they need to remain in their homes. Through a contract with Montgomery County, we also have a senior intensive supports program where for people who are 60 years and older, it does give us a little bit more opportunity to go in and do a little bit more, get involved in their lives a little bit more, just to help them remain in their homes. As I said, our community resource center, we have our full choice food pantry, care coordinator, Ask a Nurse program, and emergency financial assistance program. What I can say is that during the pandemic, we saw a 33% increase in access and usage of our food pantry. And unfortunately, that number has not gone down. There are a lot of people in the community that are still struggling with food and financial insecurity. And for anyone who lives in the area, along the main line, whenever we talk about our work and that we work with people living with low to moderate incomes, the main line is known as a very affluent area. And whenever you talk about poverty, a lot of the times you get people that look back at you and say, this doesn't exist here, but it does exist. It just looks differently. And we are there to help these people who otherwise are overlooked or overshadowed by the wealth in the area. But we do provide a very vital and unique service to help everyone remain in their homes. So just a little bit of background about why this work with you is important. Traditionally, and I will go back as far as the records go back that I'm able to find, ElderNet reports on the very basics of what we do. We report on the number of people served, volunteers, volunteer hours, clients, number of, families that are assisted, food that's distributed, and the financial assistance that's gone out that we provide to everyone. While these numbers are very important, it misses a very, very key part of what we need moving forward in terms of fundraising, and that's describing the impact that our services have in the community, going beyond looking at just numbers and focusing on how we do what we do and what makes it so special. So why the Datathon? Why now? We're changing. We have a new staff that has come in that has a lot of ideas, a lot of great ideas about things that we can do, different ways that we can enhance the services, change the services that we have so that we can provide a more comprehensive support network to our participants. We're growing. Since the pandemic has begun, we have had a lot of people from across the southeastern Pennsylvania region reaching out to us asking, is there an ElderNet in our community? And unfortunately, right now there's not. But we have a lot of people that are interested in adopting our services or having us come in and provide them. So having the stories to be able to show people and the statistics to demonstrate how we do what we do is very important to this. We are evolving. We are really changing the way that we do things. We are changing the way that our staff approaches things. But as I said, we are really missing an important piece of this puzzle. And what I'm hoping for out of this is just your help in telling our story in a different way, in a way that is going to land with funders who like to hear the anecdotal stories, but they're also looking for the hard numbers or the statistics that you wouldn't think of. And that's really what I'm hoping for here. I am looking forward to the work that all of you are going to do and finding the different ways to talk about what we do. So with that, that is everything I have. So I will turn it back over to Carla for Q&A if there's any.
There is. Let me share my screen. All right. So I'll post the questions here. Feel free, everyone, to keep asking questions. So first one is, how do you identify individuals that might benefit from ElderNet service to reach out? Do they reach out to ElderNet by themselves, or is there some other way?
So we actually receive referrals from a lot of different sources. Our biggest referral source is Lower Merion Police Department. Whenever they go into a home, if they see something or feel that somebody may benefit from our services, they can ask the people who are there, there's an organization that might be able to help, or you want to talk to them. So we do get them from there. We get some from doctors' offices, hospitals who have people or patients that are being discharged that need a little bit more support, either in the interim while they get used to being back at home, or long-term to help them remain in their home. We also have family members that reach out to us. In today's world, a lot of kids, they grow up in the area and then they scatter across the country or even across the world. So if there's an emergency at home, there's no one there to help mom and dad. We are the organization that can step in and be that help, that supportive system in place of the children. And then finally, we do receive self-referrals, people who hear about us by word of mouth or just happen to drive by, see the sign, think that we might be able to help. So they will reach out to us and just ask what kind of services we provide, and we'll get them enrolled and involved as quickly as we can.
Well, thank you for sharing with us and for the great work you do. How did you get involved with this line of work?
So I am a trained social worker. I have a master's degree in social work from the University of Pittsburgh, specializing in nonprofit management. Really, I got involved in this line of work just because the way that I approach my work is looking at the sphere of influence, the number of lives that I can touch. Working as a case manager, you can impact your caseload. As a supervisor, you can impact everyone's caseloads. As an executive director for an organization, you can impact everyone's lives, an entire community's lives, and that's what drew me into it. How I ended up at ElderNet, after grad school, I married a girl from Philadelphia. We moved out here and just kind of picked up life and went with it. But I'll say it's very rewarding. It's a lot of fun. It's never the same day over and over again. And it's just a really, really great organization to be part of.
It really is. Where does funding for ElderNet come from? And can we make a financial contribution?
Let me start with the second part of that question. Yes, absolutely. If you would like to make a financial contribution, you can do so on our website. If you go to our donate page, there are a couple of different ways that you can give. One is supporting our general fund. We have an emergency fund that is used for our emergency financial assistance program. And also we do have a volunteer, a gentleman reached out to us and started an endowment in ElderNet's benefit in the name of his late wife. She was a longtime volunteer at ElderNet. So there is the opportunity to donate to that as well. So if you go there, you can absolutely check everything out. As far as how we're funded, ElderNet is very unique in that between government contracts, foundation support, and then individual giving, our funding sources are split pretty much a third the entire way around. What that does is that it gives us the ability to be a little more flexible with things. And it also gives us the ability to be a lot more stable, whereas some other organizations may become over-involved in one type of funding source. If that funding source goes away, the entire organization is in trouble. However, we can deal with the fluctuations in donations in different ways so that we can remain a viable contributor to the community.
Okay. And are there similar groups in Philly that are similar to ElderNet? I've been helping my elderly neighbor connect to other elderly community members or services. How do we do that?
So unfortunately, right now, ElderNet is very unique. We had a Compass Pro Bono consulting group come in to do some work for us, and they did a comparative analysis, and they had to go to North Dakota to find an organization that was similar to what we do. So ElderNet, there are other groups that provide pieces of what we do. We are very unique in that we have one location where you can receive a lot of different supports to help to help people. However, I will say that one of the things that I want to get out of all of this is the ability to grow, to start offering services in different areas. So if you happen to know of somebody that needs assistance or you just need some questions answered, reach out and call us. We do have an information and referral system where if you call us, we may not be able to help you directly, but we can give you a referral or point you in the direction toward a person or organization that can help.
And for everyone, so we do have the link to ElderNet's website on our GitHub repository. So in the README file, so you can go there and have all the links that you need and get to ElderNet's website as well. Okay, what organizations are current supporters and funders of ElderNet, and what has worked well for ElderNet in the past in terms of convincing them of ElderNet's impact?
I will say that most of our supporters have been longtime supporters and funders. Montgomery County, it was our first and biggest supporter, followed by Lower Merion Township. We do receive funding from Bryn Mawr Hospital as well. I think that traditionally, for ElderNet having been around for 46 years, people know who we are in the community. People are aware of what we do. So in our own community, we don't really need to tell our story because people know it. However, it's important for us to tell our story so that as we do start moving forward and serving other communities, we are able to tell our story in a meaningful way that will draw not only volunteers into the organization to fill the needs, but also bringing funders to the table to help support the programming moving forward.
Can you describe examples of client outcomes or impacts? So do clients no longer need safety net, or do they have improved health, improved economic status? What are some of the outcomes you've been monitoring?
So that's a little bit of a difficult question, only in that we're not a cookie cutter organization. Whenever you come to us, you're not going to get this much. We sit down and we talk about each individual to make sure that they get the specific care that they need. Some people come to us, they need help while they're recovering from a surgery, and we provide rides and other supports that way. And whenever they're done, they no longer need our assistance. We have some people that whenever they come to us, they are financially unstable. Through working with our care coordinators and different referral sources, they become financially stable, and they no longer need our support that way. Unfortunately, looking at health, other than the people who come to us just in a very short time frame to whenever they're getting they're getting over surgery, most people just as they age in place, their health needs become more and more complex. So what we actually find is we have some people who come to us for 6-8 months until they get everything that they need to be stable on their end. However, we also have people that we have been serving for 20 or 30 years because the only way that they can remain safe, stably housed is through our supports. So again, it comes down to the individual, what they want and what their long-term goals are. And our job is to help them find the ability to be stable in their home as long as they can.
Got it. I see someone has raised their hand. I will recommend and ask everyone to submit their questions through Slido. It makes it a little bit easier to have an overview. And then if we have time, if there are no more questions, we can open it up to a bit of a discussion, but let's funnel all of our questions through Slido if possible.
So Slido?
Yeah, if someone could help out, could post the Slido link, please, one of the organizers, and we can manage it that way. All right. Brandon, can you remind people how to sign up to be an ElderNet volunteer?
Absolutely.
David?
So right now, if you go to our website, go to the volunteer page of our website, there's a volunteer application that you can download. You fill it out, you send it to Michelle Buller, our wonderful volunteer coordinator. She will vet the volunteer. There are some background checks that everybody needs to go through just to make sure that we're putting the right people into volunteer opportunities. After that, during that process, you can identify the different ways that you want to get involved, whether it be escort driver, friendly phone calls, friendly visits, or any one of our other opportunities. After that, Michelle will have an orientation meeting with you where she'll describe different things and provide you with the access that you need to our system to be able to go in and start taking on some of the volunteer opportunities that are there. I will say that our website, we are just about to roll out a new website. Whenever that does go live, it is going to take our volunteer application. You'll be able to fill it out on our website instead of having to download it and send it in that way.
Got it. Thank you. And let's see, have you ever utilized social determinants of health factors data, things like income, level of education, and so on, to help identify communities or specific clients in need?
We have not. The closest that we've gotten to that is we completed a community needs assessment in 2019, I believe it was. And there were, in the questionnaire that we'd sent out to the community, there were some social determinants of health that were in there, but now with the pandemic and the needs of everyone changing, that I would consider that study to be outdated, and we're probably due for a new one.
Got it. How has COVID impacted your operations? How do you see the pandemic? How has the pandemic changed the community and the types of needs that ElderNet supports?
So as with everything else, yes, the pandemic changed what we do. In March of 2020, our volunteer services, our escort driver program shut down completely. And that went through until it was the following March, I believe it was, that we started opening up just a little bit for different rides. All of our care coordination, care management, all of that was done virtually over the phone. Unfortunately, most of our participants don't have access to a computer or any other way to do things virtually. So we kept in touch with everyone through phone calls. Our food pantry got away from the full choice model, and we started distributing prepackaged bags of food to everyone. Things have shifted as the numbers have fluctuated throughout everything, but we continue to support our community in any way that they need. I think that one of the things that came out of the pandemic is that the community really rallied around the organization and what we did. We saw an increase in people reaching out to support our food pantry during the massive shortages in grocery stores and people who were isolated, not able to go to the store for themselves. We also had other people reaching out and financially supporting us because a lot of nonprofits suffered during the pandemic because you're not able to provide in-person services, which is needed for your funding. I think that moving forward, the pandemic is going to change the community in that it has started to shine a light on the needs of older adults. Prior to the pandemic, I think that older adults were often overlooked when we talked about communities in need and people who may need support and other services. But the pandemic has shown a light on things, and people now see that older adults are there. They do need some assistance, and there may be an opportunity for us to do a little bit more and support them in different ways as we start to emerge through all of this.
Well, these questions keep changing. What kind of metrics are your potential funders looking for? What are some of the metrics that may have been requested that you have not been able to provide?
So the big metric that has been requested a few times is that people want to know, looking at our services, if somebody accesses one of our services, how much do we help them? If they access two of their services, how long are they able to remain in their home? If they access all three services, what does that mean for them? Providing those stories of impact, because again, we can tell all the anecdotes that we want. However, as funders start making the process a little more competitive, to make sure that they are, supporting the programs that make the most impact, it's important for us to be able to provide these answers to them when they're making their decisions.
Absolutely. Someone is asking the question, if you can describe ElderNet's major counts, number of clients, volunteers, employees, service interactions. And I will say, Brandon, you maybe just give a very brief answer to this one, because this is exactly what we're going to be able to answer with the Datathon.
So what my answer to that would be that we do have major counts. We do report on that much. I can bore you all with those numbers now, but if it would make sense, Carla, I can send you a copy of our most recent annual report if people would like to take a look at that has all this information in it.
Yeah, that'd be great.
Okay, I'll send that over to you.
We can make that available for sure. And yeah, this is all the stuff that we have data for, so we'll be able to dig into that and really analyze it ourselves. So that's very exciting. Are there any statistical measures that you are already using when fundraising?
No, we do not have we have not had the ability to, or I should say, I haven't had the ability to sit down and actually put any of this together. Again, that's why I come to all of you, the experts, to help me understand better our story and be able to tell it in a different way, using statistics rather than stories.
Yep. And that is one of the things that we as a group can help with. So not only analyze and do statistics on the data, but also translate it in a way that can be communicated easily to people who are not statisticians necessarily, who can understand the impact in the community with stats, but not necessarily digging into all the statistical tests themselves. So that'll be on us to help translate those numbers into a story. Do you know of a similar group that helps seniors in the Delaware area? I'm assuming. Sorry.
So in the Delaware Valley, again, very few there are no organizations that provide what we do. However, there are organizations across the region that provide help for seniors. If there was a more specific focus to the question or a more specific location, I might be able to provide some more information. But yeah, if there are ways and organizations that can help seniors just about in every community.
And then I guess connected to that, can you provide services or help people outside the Lower Merion, Montgomery County area?
So we can. The only limitations on that are our funding sources. Lower Merion Township and Montgomery County, we do have to serve people in Montgomery County, Lower Merion Township with that funding. We can provide some services to people outside of that area, but we generally try to stick to the service area, simply because if we bend the rules a little bit for one person, then at what point in time do you stop bending the rules? And it's easier just to have a very hard stop line for right now, but we are looking at expanding those boundaries to be able to serve other communities.
And in addition to benefits and impacts, do you have problems or risks that you can tell us about?
Right now, our biggest problem or risk is just staffing. We are short-staffed. We have been short-staffed, and we're having problems hiring people right now. So that is the big thing that we're experiencing right now. I would say that funding-wise, we are not. We're in a good place. We do have an operating reserve, so that if we do experience a sudden loss of any kind of income, or if we have a bad year, we are able to make we are able to fill the gap with our operating reserves to make sure that we are able to continue serving people.
And without ElderNet, what would the community members you serve turn to? Would they rely on Medicare or Medicaid or other government services? How would they go about finding services and assistance?
Without ElderNet, people would rely on Medicaid, Medicare, and other organizations to help fill the gaps. Unfortunately, the very unique services that we provide, they would likely not find the services that they need to remain in their homes. And what this would be is that we go back to before ElderNet was formed. And without ElderNet, these community members who lose the ability to do certain things, they would be forced into a nursing home or institutional care setting. And there are a lot of negative health outcomes associated with moves like that if people are forced into it before they're ready to move there on their own. And I'll also say that depending on the service that people reach out to, they may or may not get the right person on the phone who's actually going to help them.
Right. Okay. For benefits programs applications like SNAP, MSP, does ElderNet complete them or refer to other agencies to complete?
We complete them. We walk through the process of completing everywhere from rent rebates, SNAP applications, the whole way to Medicare waiver program applications. That can be anywhere from 20 minutes to the waiver applications generally take 6 months to complete. So, but we do walk alongside people, making sure that they have everything they need to successfully apply for everything, but also we're there to make sure that everything gets turned in on time, so that there aren't any and nothing falls through the cracks.
Yeah, we've definitely noticed in the continuation of service has really been a focus. I'll mention this later, but us Datathon Leads have been coding the care management files over the last few months. So we've really seen all the documentation and everything that has been going into helping others. So there's a lot of making sure that clients are submitting their forms on time, filling them out correctly, and just support with that. So that's really wonderful. All right. Couple more questions. This one is an aesthetic one. So is there a color palette or font used by ElderNet for the data visuals and reports? Is there something that you would prefer us to use?
There is. I would have to get the specific numbers and everything for you, but I can certainly get that to you.
That'd be wonderful. Yeah, we'll share it with people when you send it over.
Okay.
Great. Could you turn summaries and analyses of the referrals you get from police, doctors, hospitals into a product targeted to various communities?
That's a really good question. I would be interested to see that, and just for it is something that we did discuss trying to look at. However, with our data systems that we have, most of our data is contained on Excel spreadsheets, and there are multiple spreadsheets. So it was really difficult to pull all that information together. However, I think it would be very interesting to see this and see if there's a way to to do that, use analysis to target communities. So right now we don't have the information for that, but hopefully in the near future we may be able to do something along those lines.
That would be great. And this, I'm addressing it to our Datathon community here. So if you have recommendations or ideas for ElderNet as you're going through this Datathon and as you're learning more about the data and what they do, feel free to include that in the report. We are trying to really provide and lend our expertise here, and if we can help with ideas, we should. So feel free to include that in your reports as you go through them. And then the final question, do you have outcome or program data available for trying to set up evals? I'm guessing this is going to be addressed if you share the report, Brandon, if you share your report with us.
Yeah, I think that I already sent that over to you, Carla. So send that out, and people, and if that information is helpful, use it in any way that you can to try to look at it. And again, I'm really looking forward to seeing what all of you. How you can help us tell our story in a different way.
Wonderful. So it seems like that's all of the questions. We had a lot. So thank you very much, Brandon, for giving this, for telling us about ElderNet and for really partnering with us and making this data available and giving us the opportunity to help you. We will be learning data analysis and statistical analyses with this data set, but we'll also be providing our expertise in what we know and hopefully helping ElderNet grow and develop future directions. So
well, I thank you very much. I've said it many times, I'll say it again, I'm really excited about this and I can't wait to see what this does.
We're really excited too. So I think with that said, stopping sharing for now because we are on time. We finished a little bit early, but I will say, why don't we take a 5-minute break now and come back in 5 minutes, and then we can go over Datathon logistics. We'll talk about the data that we have available and the teams and kind of what this is going to look like, and then we'll open up the breakout rooms and you can start working together with your teams. Sounds good?
All right, well, I will say this much, that I am not able to stick around for the rest of it. So I thank you all. I look forward to your questions. If you need anything more from us, please reach out to me. I'm here to make your job as easy as I can.
Thank you very much, Brandon. Really, really appreciate it.
All right, well, thank you all. Please stay well, and I will look forward to talking to you again soon.
Sounds good.
Okay.
For everyone, I will put up a timer in a second, and I will put that up on the screen so you can see how much we have. So 5-minute break, we'll come back in 5 minutes. That went very quickly. All right, so we are back. Slideshow. So in this part now we'll just go over the Datathon logistics. So what you can expect, what the data sets are, and the timeline. And then once we're done with that, we will have another Q&A session. So please use the same Slido link and Slido number to submit your questions. So we'll try and address them all in the Q&A section. And then once we're done with that, we'll go off into breakout rooms and get things going. All right, so for this part, before we begin, I just want to introduce the Datathon Leads team. So we have 3 leads from each group. From R-Ladies, there's myself, there's Sybil, you'll see her in the list here, and Mitch. And then from DataPhilly, we have Rama, Anne, and Chris. So you'll see us floating around. You feel free to reach out to us and ask us questions. So we'll be around and we'll be very active in Slack. So feel free to reach out. Okay, now going into the data sets, there are 5 data sets that we will be working with. They are fairly small data sets, so they're saved as CSV files. You can find them on the GitHub repository. So for everyone to know, so all of our work is going to be in and through GitHub. So all the data sets and the information that you need is in GitHub. So please go, if you haven't already, please go to the GitHub repository and read through it. So the data sets are in there. So there are 5 data sets that we have available. We have client info anonymized. So we have spent the last few months anonymizing the data sets that we received from ElderNet. And that means that some of this information that we can make available publicly is quite reduced, but we've tried to make available as much as we can. So every data set is going to have an anonymized ID number. So you can merge across data sets using this anonymized ID number, and this refers to clients. Then for clients, you will have county information, and in this case, you just have Montgomery or other. So it doesn't really get more granular than that. You have information on poverty. So if a client is impoverished, and this is just a simple yes or no. If the client is part of a minority group, again, simple yes and no. And age group is kind of an odd one here because we wanted to make age data available to everyone because statistically it might be very useful. However, providing the age ranges would make things identifiable because there aren't that many clients. So we were very concerned and we wanted to protect this population as much as possible. So we have grouped clients into age ranges, but we have replaced the values with just nonsense values. So you can use this variable for any model that you might want to build or to split or to display information by group, by age group, but we're not able to make more detailed information available. The second data set is a care management data set. So this data set lists all the care management interactions that ElderNet's care managers have had with clients or amongst themselves or with family members or friends or with other organizations about clients. So this is listed by client, and you'll basically see the anonymized ID, the date in which the assistance was provided, the category of the assistance, the amount. So this is going to refer to the time amount spent on this interaction, the unit, which is most likely going to be in minutes. And then you have a few other categories that we as Datathon Leads have coded based on just free text entry. So this has taken us quite a while. If you have questions about some of these categories, feel free to reach out because we tried to take plain text notes and convert them into types and variables that can be used for statistical approaches. So we have communication type, which is going to be call, email, voice message, or other, I think in person. There are a few other categories in here. Party refers to the party that ElderNet interacted with during this interaction. So most of them will be with a client, but some will be with a family member, might be with an outside organization. So you'll see that listed. Initiated by is a variable that refers to who initiated the interaction. So did a client call ElderNet? Did ElderNet call another party? Who was the initiator of that interaction? And then benefit and assistance, there will be 3 such variables. For going over it here, I only included 1, but you'll have 3 of them in the data set. So benefit refers to the type of benefit that was addressed, discussed, covered during the interaction. So this is really the category of benefit. It's going to be food, housing, medical, financial, legal, that kind of stuff. And assistance is what was the assistance that ElderNet provided during this interaction? Did they help with coordinating something? Did they help with providing information? Did they help with continuing a benefit? That kind of stuff. So you'll see several categories in there. And the description of this is going to be in the GitHub repository as well. Next, we have the pantry data set. So these are all the interactions that clients of ElderNet have had in the pantry or related to the food pantry. So this is going to be, again, you have the anonymized ID, so you can match across clients. You have assistance date, assistance category. Amount here refers to usually size, but you'll see the unit as well. So it can be 1 boxes or bags, or $25 or 25 pounds, for example. So you'll have a numeric value, and then you have the unit. So this refers to how much has ElderNet helped in terms of food. Did they give 25 pounds of food, or did they give a gift card in the value of X amount of dollars, something like that. Volunteer services is, I think it's the last data set we have about clients. Yep, the last data set about clients. So this is, this refers to rider information. So the way it's logged is every volunteer volunteers provide rides to clients. So in this data set, you have every ride logged. So who was the client who took the ride? When was this rider's last date, or this client's last date? Client's first date, total number of rides. Although I think in this case, this one we had as a constant and 0, so we're still trying to update that. So that might not be immediately useful. We have appointment dates. So when was the appointment, the date of the ride, when did that take place? The duration of the appointment, so the number of hours that a volunteer has spent with the client during this ride. And the category for the ride. So was the client going to a doctor's appointment, or to go grocery shopping, or something else? So that's going to be listed in there as well. Finally, this is a separate data set. So this is not to do with clients. This is donations data set. So this might be interesting for growth opportunities and support from the community. You have all the donations that ElderNet has received listed by donor ID. Again, this is going to be anonymized. We also provide a zip code here, status, whether it's an active donor or not, if the donor wants to be contacted by mail or by phone or not, if the donor is an organization, the date of the donation, the amount, the form, and if there was a campaign associated with the donation. So overall, these are the data sets that we're working with. So they're not big data, but they are quite rich. And if we can enhance them with additional data sets as well that we can get from census or from other places, I think we can really create a very rich picture here. The data time span, we've been given data from January 1st, 2019 through mid-September 2021. So it covers roughly 2-something years. For one thing to mention here, for the care management anonymized data set, there's going to be half of that data set is not going to have these variables filled in. So these are going to be missing. And that's because it's taken us quite some time to go through and code every single interaction. So we just didn't get to code all of them. So we apologize for that, but we did our best, and we hope that there's going to be useful information in that second half of the data set. I believe it goes to April 2020 through September 2021 in terms of what is coded. So there should be a decent chunk of coded data in there. All right, so that being the data set, now let's get to the teams. So we have 3 teams for this data set, and you are welcome to join any. And if you decide you want to switch to another one later on, that's fine as well. So we are not going to tell you which team you have to be part of. So that's entirely up to you. We have 3 teams. The first one is going to be really focusing on ElderNet's impact in the community. So this is what Brandon was asking. How has ElderNet helped clients remain in their home longer? How well is ElderNet connecting participants to the benefits that they need? So if we can help answer some of those questions with the data we have, that would be wonderful. The second team is going to be more of a data visualization focus. So this is, the task here is to create a decision-making insights dashboard for ElderNet. They currently do not have something like this, and it would be really beneficial for them to see what is possible. So we're hoping that Team 2 can put together something that's not only really cool visually, but really can help show insights, display, or help ElderNet draw some conclusions in terms of what they should do. So this is, we're hoping for an interactive dashboard that will help ElderNet leadership make better informed decisions for the future. And then Team 3 is going to be focused more on growth opportunities and also any other fun analyses that you think would be useful or relevant. So this is, I mean, they're all related, but this one's really focused on the future. What else can ElderNet do beyond what they're already doing? Is there a need that they haven't identified yet? Are there things that they should really start paying attention to? Are there trends in their staffing or how they're spending their time? So really focusing on the future and on growth, while Team 1 is focused on how have they impacted the community so far, and Team 2 is really producing visualizations that are gonna help with insights. All right, so that's the teams. So in terms of the timeline, I know 6 weeks sounds like a lot, but it really isn't, and time is gonna fly. So we have put together a description here for what you may want to do week by week. This is by no means prescriptive, so you can choose to do things differently, but we recommend that you follow this this timeline to help you stay on track, because time does fly. So we're currently here. So this is today's meetup. We would recommend that today you spend the time getting to know your teammates, setting up a plan of action, figuring out how often you want to meet, kind of how you want to tackle the problem. In the coming weeks then, you may want to run some descriptives, really get to know the data set, spend some time on that, wrap up, and then come to a conclusion in terms of the story you want to tell, or how you envision this project going. Explore data in more depth, start documenting your process and observations, and start that early, because at the end of this datathon, we will ask each team to produce not just a short presentation for ElderNet, so 20-minute presentation, but also put together a report that can be put together in a PDF format and given to ElderNet in a way that they can share with others and refer back to in the future. So we recommend that you start with documenting your process and writing your observations as you do these analyses, and if possible, start putting together the report early on, and then just add and iterate to it, because it's just going to make life easier. Towards the middle here in week 4, you may want to start running analyses that kind of flesh out your data story. At this point, you kind of want to know what is the story you're going to tell, and really start building that. Write up any conclusions and observations, start developing your dashboard, figure out what is the story you want to tell with what you're putting together. In the last weeks here, we recommend that you really start drafting the report, draft your slides, because there are going to be multiple iterations to those, and it's good to start early. And then finally, on March 30th, that's also a Wednesday, so it's going to be the same time frame that we use here. So on March 30th, we will present our results to ElderNet, and all the other participants as well. So that's going to be another session like this one, where each team is going to have around 20 minutes or so to present to the others what they found. And we have templates and examples from past Datathons that are available over GitHub or through GitHub. So go and check those out if you haven't participated in a Datathon before. There's a lot there, and really your team can choose to create one or to deviate from what we've had in the past. That's totally fine. We just ask that you include the names of everyone who participated, because we want to give credit to everyone who has helped, and really write up a report that ElderNet can share with others. A couple of other things. So questions to Datathon Leads and other participants. So we would like for everyone to join the Datathon 2022 Slack channel in the R-Ladies Slack. We are trying to keep everyone in one Slack environment so that we can all share and learn from each other in one space. So that's going to be the Datathon 2022 channel. We will have a couple of informal Zoom calls throughout the Datathon. We're not going to set up meetup events for those, but we're going to let people know over Slack as well when those happen. That's just for people to be able to ask questions, share anything that they've come across, any issues, things like that. And in terms of questions for ElderNet, we will have a Google document that is going to be shared with Brandon and his team. And so that we don't bombard them with questions, we're just going to put all of our questions in the Google Doc, and they will be able to go in there, check it regularly, and then provide their responses to the questions. So that's where that's how we'll be. All right, so that was a lot of information. Let me see what the questions are here. And feel free to ask more questions. I'll open up a Q&A now. So I'll go over these questions, but we can also open up the discussion. Is the sequence meaningful on age group? The sequence is not meaningful on age group. So you will probably not be able to trace back what the age categories are. Brandon asked about statistics supporting keeping clients in home. Is there a way to tell if a client remained in the home? So that's a good question, and we will turn it back to you. There may be ways to figure that out. So you can have a look at maybe a client's first ride, or how long they've had, what kind of interactions, how long they've had interactions with ElderNet between the first and the last. But that hasn't been, there isn't an easy metric that I can point to that you'll be able to use. So I would turn this question back to you and ask if you can come up with creative ways to figure out how long someone has stayed in the home, or ways to answer this question with the data we have. We may be able to ask ElderNet for more data, although I am not sure that we'll be able to get that data in time, or that it will be clean enough. So I will strongly recommend that we try and figure out how to answer these questions with the data that we currently have. Are the anonymous client IDs consistent for a client, or are they new for each client interaction? They are consistent. So you will be able to trace a client's interactions with ElderNet over time. It's going to be the same client ID. Is there data on when each client first interacted with ElderNet? So you'll have that in the rider information. Otherwise, I don't think you will have that exact date listed for the care management or for the food pantry. Unfortunately, we have asked, but it's not easy to get. So again, we might need to be creative in how we figure out when they first started, how long ElderNet has helped a given client. How do we sign up for a team? There is a Google document that, let me see. We can share, I can share with the teams after, once we go into breakout rooms. So, oh, I see it's already shared in the chat. So there's a Google document that has different tables for each of the 3 teams. So fill out your name in there, your Slack ID, so people know how to reach you on Slack. Your GitHub ID, so that you can be added to the team's repository if you choose to work on it that way. And basically just join the Slack channel for the team. So each team is going to have a Slack channel, again, on the R-Ladies Slack environment. So join that Slack channel, introduce yourself to the team, and get started. Will the dashboard for group 2 likely be built in R? I'm interested in joining that group, but I only know Python. So that's a good question. So we are letting people choose the language that they want to participate in. There is a little bit more support for R, but if you are comfortable with Python, we are not going to stop you from using it. That said, we will leave it up to each team in terms of how you want to set that up and what your team decides is the best way to go about it. Ideally, it will be one integrated dashboard, but if you can make a reasonable argument for 2 different dashboards or some other way to integrate them, by all means do so. There are packages that allow to run Python code in R or vice versa. So check with your teammates and figure out what the best approach is there. So there are options. So we're not restricted to R. There's just a bit more support for R if you choose to go that way. We might not be able to help you with Python questions, so that's the only thing. Where is the Slack channel? I will ask one of my co-leads or co-organizers to post the link to the Slack channel in the chat here. Otherwise, it should also be in the GitHub repository. For beginners in data analysis, software that's required. So you can choose your own, whatever software you feel most comfortable in. We recommend either R or Python because that's going to be the majority of people who are here, and will be able to help you. If you're a beginner and just starting out, you're going to be able to get a lot of help from your teammates on either R or Python. So those would be the recommended ones. But if you have another one that you are much more comfortable in, you can use that, but you might have to work with your teammates to see how you can bring in your results or analyses into the bigger report. Can we see the teams again? Yeah, so all of this information is in the GitHub repository. So there's going to be, the slides are available in there if you want to have a look. The teams are listed, the data sets are listed, as well as there's a data dictionary in there and the raw data. So just go to GitHub, everything should be listed in there. And how will the groups be combining their work? GitHub is the way to go. So we would prefer that all the groups work together over GitHub. We want to save this work and make it available to anyone who's interested in coming to this later as well. So we want this to be available and public, and we want to be able to share it with ElderNet as well, in case at some point they have an analyst on their end who wants to use some of this and develop the dashboard further or create a different report that uses some of these components. We want that to be available. So we do encourage everyone to use GitHub. And if you're new to GitHub, there are plenty of people here who can help, and we also have some information materials on our repository, which is public, and you should be able to just access it by clicking the link. So you don't need to install anything.